Healthcare advocates were here this morning at Queen's Park to oppose what they call the gutting and dismantling of public hospitals. And they say they now have the evidence to prove to the Ford government that the people of Ontario are against further healthcare privatization.
We are the 99%!
A strong show of support at the steps of the legislature, dozens of healthcare advocates from communities across Ontario delivering hundreds of thousands of ballots to the Ford government in an effort to stop Bill 60.
They want it to be about patient health, not private wealth. That's it. That's what these ballots say.
The question on the ballot, do you want our public hospital services to be privatized? We're told almost 400,000 people voted across Ontario, 100,000 right here in Toronto, in what's being described as a citizen-led referendum organized by advocacy group Ontario Health Coalition. 99%, or almost 380,000 people, voted no.
That is not insignificant, and if this government wants to continue to call it a stunt or whatever, I challenge them, hold your own referendum. Actually consult with the people of this province if you're going to gut our healthcare system.
What kind of difference do you hope this makes?
Well, I think it's pretty hard to ignore, almost 500,000 people. I think it would be to their peril not to listen.
I don't call it a referendum. It was a political poll driven one side.
The Premier responding earlier this week, his government says Bill 60 will eliminate the surgical backlog and reduce wait times by allowing more private, for-profit clinics to offer publicly funded surgeries and procedures.
Well, this is the way the poll should be, is do you want to wait in line for a hip replacement for 18 months? Or would you like to get something done in 60 days from the exact same doctor? The exact same doctor in a surgical clinic.
But critics say Bill 60 will cost more for patients and taxpayers, allowing the simplest surgeries to be done for the highest price, while existing operating rooms inside public hospitals aren't being used at capacity.
They had the money, they made the choice. At any point, they could have cleared up that backlog. When you see the result of that backlog, when you see cancers getting worse, and you see the people, their pain, their suffering, the loss of their loved ones because of that backlog that they created, your heart utterly breaks.
This vote is the beginning of what advocates are calling a relentless campaign.
We're not going to stop. We'll ratchet it up from here, and the next thing will be the massive, massive protest, as big as we can build in Toronto at the legislature to stop them.
Do you think this is going to make any difference?
You know what? The only thing that moves this government is if people speak up and put pressure on them. That's exactly what this is designed to do.
Worth noting, the Ontario Medical Association and Ontario Hospital Association have both come out in support of Bill 60, calling it an important step to reduce wait times and free up hospital resources to focus on emergency and complex cases.